According to the International Diabetes Federation, there are reportedly 3.6 million cases of diabetes in Nigeria. However, experts argue that the actual figure might be significantly higher, suggesting at least 11.2 million individuals affected. In separate interviews with the News Agency of Nigeria, health experts emphasized the importance of embracing a healthy lifestyle for preventing and managing diabetes. Dr. Ebenezer Oladeyinde, Medical Officer of Health in Amuwo Odofin Local Government Area, shed light on key risk factors associated with the disease.
The risk factor are age. That means as we get older, we as black, we as Nigerian, we as people of African descent have higher likelihood of having diabetes mellitus. The other one is inactivity. Anybody that is living a sedentary life has a higher risk of having diabetes mellitus. The other one is family history. By family history, we mean if your parent, mother or father, or your sibling, sister or brother have diabetes mellitus, that means you have higher likelihood of having diabetes mellitus. Diabetes mellitus could also result from other chronic diseases that makes person inactive. So, what are the clinical signs? I have mentioned that a lot of time diabetes mellitus may not show any sign, so we should go for screening. But when it does show sign, we could have increase in thirst. This person says, I drink water more than usual. If anybody have that history, it's better to screen himself or herself. Then there could be polyphagia. That means we are eating more than usual. You get hungry more than usual. Your appetite increase more than usual. It could be a sign of diabetes. We advise that you go for screening. And if these things persist over a long time, there can be weight loss. All of a sudden, you see that your clothing that are tight, they are becoming loose, or people are calling your attention that you are losing weight. It could be diabetes mellitus. Sometimes, for those that are not very conscious of themselves, diabetes mellitus may result from presenting other things like skin infection, things like numbness of the leg, difficulty in seeing as a result of diabetes complication. So sometimes complications can be the signs, and sometimes. So we encourage that people should get screened.
Mrs. Oludayo Coates, Head of Department, Dietetics and Nutrition, Alimosho General Hospital Igodo, speaks on the role of diet in managing diabetes. She also provided insight to debunk certain myths surrounding food intake in relation to diabetes.
We have to try as much as possible to correct the misconception, the nutritional misconception about diabetes. One of the facts, myths about diabetes is that you have to stop eating carbohydrates or starchy food, e.g. bread, amala, semoya, rice, etc. as a diabetic patient. But the fact is that you can still eat carbohydrates as a diabetic patient. Just follow your portion control as recommended by a registered dietitian. That is it. Another myth about diabetic patient that patient with diabetes should eat more of wheat. Wow, wheat also raises blood sugar level, especially processed wheat. So it has to be with portion control. And that's what we discover that most patients, when they want to eat at a diabetes patient, it's only wheat, which even can spike up their sugar level. So that's why there's need for you to miss a registered dietitian. Okay, another myth is the diabetic patient should eat more of beans. Oh, don't you see that it's very, very common for patients that on diabetes, they eat only beans, akara, moi, ewa, morning, afternoon, and night. That is the only thing that they eat. With beans too also contain carbohydrates. If you take too much of carbohydrates too, it will even affect your kidney, and also too, you have to take at least protein as recommended by your registered dietitian. Your carbohydrates portion control, because beans still contain carbohydrates, so it has to be portion control. You can eat all the meat and fats you want because they have zero carbohydrates. No, you have to reduce your fat intake, especially most meat contain saturated fat. For a diabetes patient, you have to reduce your fat intake. You cannot say because it is proteinous food, you just eat anyhow. It has to be within your portion control. If you take diabetes medication, you don't have to watch what you eat. Many people are falling victim of this because they're on medication. They don't control their diet. Please, if your medication, you still need to watch what you eat. Then this will help to reduce the dosage of your medication and to have a balanced life and good maintenance and control of the diabetes. Sugar-free products are healthy. That's a deception. You need to be sure of the nutritional label because there are some hidden fats too. There's some things too that are high calorie, high fat that are present in that food too that can spike the sugar level. So don't just be deceived by the label sugar-free food. Check your nutritional information, it's very key. Food is bad. No. There's no particular forbidden foods for diabetic patients. It's just that some fruits are naturally high in sugar than the other. And usually we consider the fiber content of these fruits. So the fruits that are very good for diabetic patients in terms of apple is very high in fiber, it's very good for diabetic patient. Cherry is very good for diabetic patient. Grape is very good for diabetic patients. Avocado pear is good for diabetic patients.
Nigerians are advised to maintain a healthy diet and lifestyle and have regular blood sugar checks.